Dr. Menon and Ms. Narasimhan to felicitate the Honorable Minister. Thank you, Mr. Menon, Ms. Prabha. And now with great respect, may I request JP Nadda ji to kindly deliver the keynote address.
आज के इस कार्यक्रम में उपस्थित मेरे साथ श्री संतोष मेनन जी, मिस प्रभा नरसिम्हन, the Managing Director and CEO of Colgate Palmolive India Limited, experts, health professionals, leaders in the health area, and my friends from the print media and electronic media, ladies and gentlemen. It's indeed a matter of great opportunity for me and a very happy occasion when we are discussing a very critical subject, that is the oral health. When I talk about oral health, I also congratulate the Colgate Palmolive India Limited and the News 18 for collaborating and organizing this summit. As we all know that the Colgate India has started a movement which started in 2024, which I am told, and along with News 18 Network and the Indian Dental Association, that they have tried to create an awareness about the oral health, which is a subject which needs much attention at this point of time. So I really congratulate and thank them for coming out with this program. It is also very heartening to note, बहुत खुशी होती है कि experts और हमारे policy makers और हमारे public के stakeholders, all three together have gathered here to discuss how to strategize and how to see to it that in future how we can address this issue. That is very heartening to note. If I talk about the program which was started by the Colgate and the News 18 network, it is about the awareness, about making people aware about the good practices and promote oral health, and also it is also related to nutrition and very much related to tobacco cessation. So all this combined together, an effort has been made that in a holistic approach, how do we address the oral health issue that is very important. I'm told that that more than 5.5 crore population has been touched, or more than 5.5 crore population have been brought into the ambit of this movement. And also I was told that 40 lakh screenings have been done. That means 4 million screenings have been done. That is very encouraging. And I thank and I congratulate Colgate and News 18 for this. Here I would also like to talk about the importance of the oral health. Although we give very little attention to the dental and the oral health, but that is one of the most important aspects. Our rishis, our sages, our saints used to say that it is the gateway of the body. यहीं से शुरुआत होती है और इसलिए we have to give due priority to oral health, which has been neglected and which as a common man, we consider it to be not very important area, but it is one of the most important area which needs to be addressed. It also helps us to address the systemic health, and for that also we know that there are many problems जो हम फेस करते हैं, और उन प्रॉब्लम्स को सॉल्व करने में oral health is a very important factor. Nutrition is also, and for the quality of life. Here I would like to say that under the dynamic leadership of Prime Minister Narendra Modi ji, the National Oral Health Program was started in 2014. So we can say that since our government came, top priority was given to National Oral Health Mission and National Oral Health Program. And for that, we decided that oral health should be accessible, affordable, and not only accessible, affordable, but a quality health care should be given. And for that, we had to develop the systems, the structures, and the training part, which was very important to make it, to implement it at the grassroots level. You will be happy to note that as far as the oral health is concerned, in 2014, this program was only in 103 districts. And now, after a decade, I can say that it is now, the program is being run in 773 districts. So a long leap has been taken. And this itself means how the policy makers makes a difference, and how the implementation part starts. Because the National Oral Health Program started in 2014. That means before that, the attention towards oral health, as far as the government of India's policy makers was concerned, was not as it should have been. But now, since 2014, we have been able to go forward. I would like to share with you that in 2014, we had only 398 dental care units. And now we have 9,183 dental units. So you can understand how many times the structure and the infrastructure for the dental healthcare, because talking about dental healthcare does not mean anything if you do not make it realize. And when you have to realize it in reality, you should have the structure, you should have the manpower, you should have the HR. So all that was taken care, and now approximately 9,183 dental care units are being run. The National Health Mission also gave due priority to this National Oral Health Program. And when I talk about that also, 99.5% of the district hospitals were given the dental care unit by the National Health Mission, that by the National Health Program. And in the sub-district also developed 3 national resources. One is the oral potentially malignant disorders, which is being run in Lady Hardinge Medical College. The another is the oral health care for children and elderly, that is being run in PGI Chandigarh. And the third is the oral health for tobacco cessation, which is being taken care by the Maulana Azad Medical College and Medical Sciences. As far as the Government of India is concerned, I would like to share with you that the oral cancer, the screening or part of the oral cancer, the program for the prevention of control of NCDs, a total screening has been done for 31.98 crores. That is, the screening part has been done. And the persons diagnosed with the cancer was 1,77,000 who are being diagnosed and who are being treated through this screening. So this is all because of the infrastructure which we created, and because of the infrastructure in the past 10 years, these screenings were done, and because of these screenings, we were able to diagnose the cancer, oral cancer, and the treatment started. The patient being treated is 1,67,000. I'm just giving you the figures just to strengthen my argument that how Government of India is trying to go forward for the addressing the issue of oral health. The Ayushman Bharat, we have got Indu Bhushanji here. He was the person who was the first CEO of the Ayushman Bharat and the architect who developed the world's largest health coverage program. And in that also, 22 procedures of advanced oral facial surgical interventions were included in the Ayushman Bharat package, and approximately 15,900 claims were made, and more than 12 crore 34 lakh has been spent on addressing this issue as far as the oral health cancer is concerned. The milestone was in the oral health, that was the National Referral and Research Institute for Higher Dental Studies, that is in All India Institute of Medical Sciences, Delhi. So it's not only that we are trying to see to it. Dr. Kharbanda is there, I can see him. He was there at that point of time when this was being materialized. And it's not only that at this point of time we are doing treatment, but we also need an advanced research system. And for that advanced research, the All India Institute of Medical Sciences, a pioneer institution of Government of India, has taken the lead that I would like to share. Which was inaugurated in October 2024 by Honorable Prime Minister. I would also like to share with you that how policymakers make a change. You see, we had a policy of health policy was initiated and developed in 1997. That policy was a policy which took care of the curative part. It was only the cure part which was taken care. And cure part also, the tertiary healthcare was given the utmost priority. But in 2017, we came out after due consultation with all the stakeholders, having conferences, regional conferences, talking to the stakeholders, talking to experts, and then we came out with a National Health Policy of 2017, which was holistic in nature. When I talk about holistic, it was inclusive also. And when I talk about inclusive, it means it was not only the curative part, it was the preventive part, it was the rehabilitative part, it was the curative part, it was the geriatric part. All together in a holistic manner, we have tried, and that health policy in 2017 was initiated. Utmost priority to the primary health care. And when I talk about primary health care, it means that now we have got 1,77,000 Ayushman Arogya Mandir, which was previously called as sub-centers. Now this Ayushman Arogya Mandir, we have a healthcare package of 12 packages of 12 areas which is being addressed at this. We have a community health officer there, and with community health we concentrate on the reproductive and the child health. We take care of the ENT part, the eyes, nose and throat. We take care of the dental part, the mental part, and the early palliative part. And mass screening is being done for hypertension, for diabetes, for cancers, and in cancer for oral cancer, cervix cancer and breast cancer. The screenings are done at the Ayushman Arogya Mandir. Now again, I will again emphasize that what is the importance of the structural change which has been brought. When I talk about 1,77,000 Ayushman Arogya Mandir, this is the first point of contact. And this is where the care starts. And 50 crores have been screened for oral cancer, breast cancer is 7.5 crores, and cervic cancer 4.5 crores. So this, you imagine the number itself speaks how the urban life who are not aware about the oral health, they are being brought into the fold through these आयुष्मान आरोग्य मंदिर. इन लोगों के माध्यम से हम प्रयास कर रहे हैं कि उनको वहाँ पर इसको किया जाए. और सबसे अच्छी बात यह है कि we have started teleconsultation in these आयुष्मान आरोग्य मंदिर. So when I talk about teleconsultation, you don't need a specialist. You need a community health officer who is only going to take care and who is going to screen and show the x-rays to the dental health care doctor, the specialist, and he is going to suggest that he is to be brought to the community health center, or he is to be brought to the district hospital, or he is to be brought to the state hospital, and then that is how the care is being taken, and this I would like to share with you. Increase in next 5 years, that is how we are working. The PG seats increased from 31,000 to 74,000. So we are trying to see to it that how the PG seats, and all this I am talking because so long as you do not have the sufficient manpower, so long as you do not have the sufficient HR, human resource, so long as you do not have the technicians, we cannot really cater, it may be dental health, mental health or any other health. So that is why the increase is so immense that on which we are working. Since 1960s till the end of this century, we had only one All India Institute of Medical Sciences in New Delhi. Only one. It was in Atal Bihari Vajpayee's time that we had 6 more All India Institute of Medical Sciences. And during Prime Minister Modi's regime, now we have got 22 All India Institute of Medical Sciences. A state of the art, state of the art. So now our doctors, our medical students need not to go outside. We have got the best facilities here for research, for development, for addressing the health issues, and that is how we are working. One more thing I would like to share with you is about the Ayushman Bharat. Hindu Gujarati is there. When I say it is the world's largest health coverage program. In 2015, I got the opportunity to, as a health minister, to chair the World Health Assembly. Because at that time, the chair was with India, and I, being the health minister, had been to Geneva to chair the World Health Assembly. I never talked before that. I only talked कि 2014 में क्या था और 2025 में क्या है. अब हम किसी की नजरें तो ठीक कर सकते हैं. As health minister भी मैं ठीक करवा सकता हूँ. But I can't give them the eyesight. I can't give them the vision. मैं दृष्टि नहीं दे सकता हूँ. और मैं इतना ही जरूर कहना चाहूँगा, और क्योंकि मैं न्यूज़ 18 के कार्यक्रम में आया हूँ, तो इसको राजनीतिक रंग तो नहीं देना चाहता, लेकिन गैर जिम्मेदाराना विपक्ष प्रजातंत्र के लिए घातक होता है. ये हमको समझना चाहिए. Irresponsible opposition is very dangerous for democracies, and so we should realize and we should understand what the difference brings, what the difference comes with the change of the policy makers, what difference it makes as far as the implementation part is concerned, and how India becomes healthier and healthier under the dynamic leadership of Prime Minister Modi. Thank you very much for being here.